Hello, my name is Victoria Trevino, and I'm glad to have this opportunity to present this health program that I've been working on the past few weeks. The topic is over tackling lead prevention in children in Hunt County, Texas. Lead poisoning in children is a dire issue as there is no known safe blood lead concentration in the body. Even the smallest amount can cause severe issues in the growing body of a child. Lead is found in many things, such as lead pipes, contaminated water, lead-based paint, contaminated soil, food, and toys. Children are exposed to it by ingestion and inhalation. The lead then distributes throughout the organs and accumulates in the teeth and bones, where it is stored. Children are the most vulnerable age group as they absorb 4 to 5 times as much ingested lead as adults from the same source, and their curiosity and hand-to-mouth behavior puts them in even more danger of lead exposure. Lead poisoning can affect the developmental of children's brains and nervous systems. These effects can lead to comas, convulsions, and death. If the children survive, it can result in behavior disorders, intellectual disabilities, and growth and developmental delays in the body. These effects are believed to be irreversible, and the brain and the nervous systems are not the only ones affected. In addition, lead poisoning can cause anemia, hypertension, and toxicity to the reproductive organs. In the chart above, the blood lead levels in children under 72 months of age is shown. This chart shows that in 2018, 2.6% of the children in the U.S. had a blood lead level over 5 micrograms per deciliter. In Texas, 12.7% of its population was tested in 2018, and 1.6% of the children had a blood lead level over 5 micrograms per deciliter. In Hunt County, 14.6% of the children's population in 2018 was tested for elevated blood lead levels, and 2.9% of the children had over 5 micrograms per deciliter. With the new CDC guidelines for safe levels of blood lead level being changed from 5 micrograms per deciliter to 3.5 micrograms per deciliter, even more children are considered at risk. Hunt County was found to be 0.3% over the U.S. average and 1.3% over the Texas average, making it a cause for concern. Primary prevention, by removing lead hazards before they can cause long-term effects, is the safest and most cost-effective measure in protecting children. Unfortunately, socioeconomic and individual barriers are in place that prevent that. The most common prevention is through blood tests. If elevated blood lead levels are found, the CDC recommends a change in diet, follow-up blood tests until the child has safe blood lead levels, and referrals to dietitians, neurologists, pediatricians, and medical toxicologists, making it a costly medical intervention to the families, and a referral to a neurologist for brain developmental scans. Factors that put an individual at risk include individual, socioeconomic, and environmental, as they all have the chance of increasing someone's risk for lead poisoning. Individual factors include eating habits that have lead, like those found in certain candies containing chili powder, tamarind, and other spices imported from other countries. Beauty routines and ingesting ethnic or traditional medications may impact lead exposure due to lead being found in cosmetics such as Kool and traditional medicines that contain herbs, minerals, metals, and other animal ingredients where lead may be transferred accidentally during the makings of these products. There is no way to know that lead has been transferred to these products as there is no taste or smell associated with lead, making these individual factors an increased risk of lead poisoning. Socioeconomic factors, such as living in a home built before 1978 with lead-based paint and lead pipes, and not affording to move to a home free of lead hazards, is a contributing factor. Other socioeconomic factors include their jobs and undernourishment, as lead dust from being exposed to lead hazards during jobs can stick to clothes, skin, and hair, and get trapped into the house, exposing other family members. Undernourishment is dangerous for children, as lack of calcium and zinc means that children absorb more lead. Other contributing factors to lead exposure are environmental factors, such as living in areas with contaminated soil and living near Superfund sites, which are locations contaminated with hazardous waste. Often, lack of awareness over the topic of lead, signs of lead poisoning, and where sources of lead exposure may come from contribute to this preventable issue. Working with organizations is a great way to protect the community and spread awareness about the dangers of lead and taking steps to remove lead hazards. This is why my hope is to partner with the Texas Department of State Health Services, as it is an ideal organization to work with about lead, as their goal is to promote and protect the health of Texans. Their vision is to create a healthy Texas through prevention, intervention, and partnerships with other organizations. My hope is to partner with your organization to tackle this dire issue. Successful programs that have made an impact on lead poisoning are the CDC's Lead Prevention Program and New Hampshire's Healthy Homes and Lead Poisoning Prevention Program. The CDC used a multi-level theory to fight the barriers and increased risks for this issue. They created a surveillance system and partnered with other organizations. The New Hampshire's Healthy Homes and Lead Poisoning Prevention Program used a communications theory to raise awareness in the community and help the community understand the importance of prevention and testing through education sessions. These programs show that these programs can be successful in making an impact on these children's lives and protecting them from the harmful effects. A study conducted in China showcasing case studies of children with elevated blood lead levels were resolved when the root of the problem was found and removed. The families were educated on lead sources and taught lead reduction strategies. This shows how education and strategies can prevent lead exposure to protect individuals from the harmful effects of lead. A lack of healthcare providers with knowledge of the signs of lead may also contribute to this issue. It's important to stress the importance of public health nurses who can identify behaviors associated with lead poisoning and how they are a critical factor in protecting communities. Many of these programs and studies are useful tools for inspiration as they face many of the same barriers as the ones that we will be facing in Hunt County. My proposal is to use theories such as a communication theory, which is the usage of channels to distribute important health information to the audience of choice. This theory would be the most significant way to decrease lead poisoning by educating and spreading the word to children's guardians and doctors, the most prominent helpers in changing this issue through social media. Community mobilization, when the community takes action to draw attention to an important health issue that requires change. This theory helps minority and rural communities, such as Hunt County, to increase their access to resources and reduce lead exposures. Prevention is essential to keeping a child safe from lead, removing hazards, and bringing awareness to lead exposure and the dangers they can bring to developing children is critical in protecting them. Individual level factors that help children are blood screening, cleaning up lead dust around windows, floors, play areas, and washing hands and toys with soap and water. These factors relate to communication theory, as the child's guardians are the ones who are cleaning up and taking the child to blood screenings and are the ones who need to be educated about the harmful effects and signs of lead poisoning to protect the vulnerable. My recommendations include socioeconomic and individual interventions by educating the community and taking action. Education sessions to gain knowledge of the effects of lead on the body, lead sources, and how to clean after lead dust would help decrease elevated blood lead levels. Socioeconomic interventions include removing lead hazards like lead pipes and lead-based paint in low socioeconomic families' homes. By putting these actions into place, the hope is to decrease blood lead levels in Hunt County and protect the vulnerable to improve their quality of life. The logic model shown on the screen helps visualize the components of the program aimed at preventing childhood lead poisoning in Hunt County and the planned preventative measures. The model above shows the necessary resources and planned activities for this program. It also shows the outlined goals intended for this program and impact, such as decreased blood lead levels in the community, raised awareness about the signs, effects, and lead sources, and awareness of cleaning after lead dust, and an increasing in blood lead tests and home inspections for lead hazards. In conclusion, this program would help prevent lead poisoning in children in Hunt County. It is a severe and entirely preventable issue that needs attention. Action needs to be taken to protect children from irreversible harm. Working with organizations like the Texas Department of State Health Services that has a voice that can spread the dangers and signs of lead poisoning will help aid vulnerable populations like low socioeconomic families and those living near hazardous environments. Through health education sessions on the importance of cleaning after lead dust and testing children's blood lead levels regularly, this issue will decrease. Helping economically disadvantaged families remove lead hazards will also dramatically reduce lead poisoning and protect children from the effects. The program's goal is to educate communities about lead poisoning, increase blood lead level testing, and reduce lead hazards in homes. Possible limitations to this goal are socioeconomic factors regarding houses built before 1978 and the cost of removing lead hazards. Another is lack of participation, as many may not know the severity of this issue or believe that it is no longer a problem. Thank you for taking the time to listen to my program proposal for lead prevention in children in Hunt County, Texas.